So we are still developing the skills that are required to make a great surgeon. We are talking about the basic surgical skills. In this section, we'll talk about the skin incision. This is the time you ask your staff nurse to hand over the 10 blade. So before asking for the 10 blade, you should know what a skin incision actually is. We'll talk about the abdominal skin incisions first. Then we'll talk about the laparoscopic surgery, and we'll see what type of incisions are made in the laparoscopic surgery. And finally, we'll see how the trocar, the first instrument that is inserted in the laparoscopic surgery, how that is done. So starting off with the abdominal incisions, these are the blades with which you make your abdominal incisions. Here you can see this is a curved blade, again a curved blade, a slightly pointed. This is a pointed tip blade, and this is a slight curved. So we'll see what are the various types of blades as well, for which purpose they're actually used and how to use it. With the passage of time, you'll get to know how to select the appropriate blade for your surgery and what is the best blade to ask for. With this always comes with experience, so hold your horses. You'll get to know what to do in due time. So starting off, using scalpel and blade, you make your incision. The incision should always be at a 90-degree angle, and it is drawn gently across the skin in the desired direction. So the angle between your scalpel and the body should be 90-degree. It should be a sufficient amount of pressure is required to pierce the skin. You should not be shaky while performing your first incision, and the incision should be in sufficient amount so that you can explore whatever organ you need to require to explore. Now, this incision is facilitated by tension being applied by your fingers across the site of your incision. The fingers of the non-dominant hand, like this, you place your fingers and then you apply your incision in a 90-degree angle holding the scalpel. Now, the surgeon must ensure that in no time the scalpel blade is directed at their own fingers. So it is very important that you might not injure yourself. For that, the scalpel blade should always be away from your fingers. Now, what blades for skin incision? These are the curved cutting margins. Here you can see these are the curved cutting margins. These blades are used for skin incision. Now, for an arteriotomy or drain site insertion, we have a sharp tip blade. Here you can see this is a sharp tip blade. So this is how you differentiate into various into what types of blades are actually required for what procedures. Now, moving on, you should always remember that you should never apply an oblique incision to the body. Now, what happens when you apply an oblique incision? It does not follow the Langer lines. And when the incision is not following the Langer lines, it might not heal properly, give rise to an ugly scar. It might result in a gaping wound. And there are lots and lots of problems with that. So you always try to make a straight incision, never an oblique incision. So scalpels should be passed in a kidney tray around your surgical field. Never hand a pointed sharp instrument directly. Never handle it directly, because these instruments are pretty sharp and they can damage you as well. Now, the diathermy, the laser, the harmonic scalpels, and combination devices can be used instead of blades. These are some of the newer devices that can be used for cutting as well. So these devices can be used besides the use of blades. However, the use of blades still remains the most used method for performing incision. Now, what factors you should consider while performing an incision or while making an incision on the human body? So the incision should always follow the skin tension lines, which are known as the Langer lines. So So these are the Langer lines on the anterior aspect of the body. These are the Langer lines on the posterior aspect of the body. It is important to understand that these Langer lines are the lines of tension. When an incision is given along these Langer lines, it tends to heal easily. It tends to heal with a small scar, and it's not a very visible incision. Mind you, incision is the only part of the surgery that the patient himself sees. So your capability is actually drawn with the type of incision. The better looking the incision is, the more capable a surgeon is thought of by the patient. Now, no anatomical structure should be involved in the incision. You should always avoid any neurovascular bundles. You should always avoid any bony prominences. They are very important. You should always avoid a joint for an incision. Never perform an incision on a joint, because it will reduce the mobility of that joint. Now, cosmetic factors are very important. Again, as I've mentioned, the patient remembers you by the incision. Incision is the only part of the surgery that is visible to the patient. So cosmesis, the cosmetic effect of that incision, is very important. Whenever an incision has to be performed on an exposed part of the body, make sure it's as minimum as possible and heals with as little scarring as possible. Now moving on, we have the incision should have adequate access for the procedure. You should always perform an incision which should have an adequate access. Never perform such a small incision that you cannot access your organ properly. The goal of performing the incision was to perform your surgery. You should always keep that in mind. Cosmesis is not the primary goal. You should always consider cosmesis, but you should never compromise your surgical field for the sake of cosmesis. Now, as we've talked about, the skin tension lines, they represent the orientation of the dermal collagen fibers, and incisions which are parallel to these, they heal better. Now, we've talked about this before. No bony prominences should be involved, and the crossing creases should not be involved. The underlying structures, the nerves, the neurovascular bundle should always be spared. Now, the cosmetic effect, we've talked about it. And finally, the functional effectiveness of the incision, that is very important. So what's the rule of thumb? So rule of thumb is that an elliptical incision must be at least 3 times as long as it is wide for the wound to heal without tension. Now, why is that? Elliptical incision is again a type of a circular incision. Circular incisions are usually not recommended in the body, but sometimes you don't have a choice. When you do not have a choice, you have to make an elliptical incision. So whenever making an elliptical incision, always remember the length of the incision should be at least 3 times as long as the width of the incision, so that the incision might heal without the formation of, without any tension. So what if a dog ear appears in that? Now let's see how we treat a dog ear. So in this case again, the excision is must if the Langer lines are not apparent. So the Langer lines were not apparent and you have to make an excision. Now what you do, you make a circular incision. Now circular incision would convert to ellipse incision, and why is that? Because of the Langer lines. So the Langer lines will follow the patterns of the tension and will convert a circular incision into an ellipse incision. Now dog ears, this is a dog ear. So what is a dog ear? Dog ears appear in the corners of the elliptical incision. So what happens? You are trying to suture this incision and this portion has appeared as a dog ear. It looks just like a dog ear, hence the name dog ear. So a dog ear has appeared at the corner of an elliptical incision. So how do you treat this dog ear? You satisfactorily improve this dog ear by first cutting along this XY line, this dotted line. Now, once you have to first pull the dog ear up with a hook. Here you can see a hook is being used to pull it up. After that, you have to cut along this XY axis. Once you have cut it along the XY axis, a flap like this would appear. Now you excise the flap along the XY line. Here you can see this is the XY line. You excise along it. Once you've excised along it, you suture your wound, and this is how you remove the dog ear and improve the cosmesis of your wound. So this is why the length should be thrice the width of the wound, because now the circular incision has been converted into an ellipse, and the dog ear that has appeared has now been satisfactorily removed, and the incision side is linear once again. So moving on, these are the various types of the abdominal incisions that are performed on the body. We'll not go into the detail of these incisions. We'll talk about the incisions in general. So the incision has to be planned well in advance before the surgery. When you have the imaging, when you have the patient, you should always know what type of incision you'll use to get into your patient's body. So for example, performing an appendicectomy, you'll perform a McBurney's incision. You're performing a laparotomy, you'll use a central midline incision. So it should always be planned well in advance. Now you should consider the access to the relevant organ, the pain control, and the cosmesis. We've talked about it. Now the transverse or vertical midline or paramedial incisions are very commonly used. These incisions are deeper through the subcutaneous tissue. Now the mass closure of abdominal wall is usually advocated, and usually this is done by taking large bites. So after you've done with your surgical procedure, it is advised that you should mass close the abdominal wall with large bites. Now, short steps in closure techniques and non-absorbable sutures should be used. So you should always go for shorter bites, and with shorter bites, non-absorbable sutures and PDS sutures. PDS sutures are the type of sutures. So these PDS sutures should be used. These are very strong and help the abdominal wall to close and heal itself. Now the length of the suture material, a very important factor, should be 4 times the length of the wound. So always remember the length of the suture material should be 4 times the length of the wound. So now moving on to the laparoscopic approach. So we've talked about abdominal incisions a lot. Now we move to the newer horizons, and with that, the laparoscopic surgery. So what are the various principles that should be considered in the laparoscopic procedures? So first of all, the various important points, the umbilicus. Umbilicus is important because it's convenient, and this a safe point for the insertion of primary trocar. Why is the umbilicus a safe point? Because it is bound posteriorly by fibrous bands and decusating fibers, and there are not many nerves or neurovascular structures in the area. So it's a comparatively safe area. Now you have to make sure that you avoid the bowel and avoid injury to any major vessels. In thin female patients, this is a difficulty because they are at greater risk of injury to the bowel and the major vessels. Now, the midline is safe for the secondary trocars as well. Now, you should always avoid the bladder. The bladder drainage is one way to avoid injury to the bladder. When the bladder would be drained, it could not be injured during the insertion of trocar. So, moving on, open or semi-open technique is used to minimize the injury to the underlying viscus. Now, for midline scars, the primary trocar is inserted away from the umbilicus. It is inserted away from the midline with an open cut down and optical trocar. Now, in case of a midline scar, what happens? A scar is already there in the midline. Now you need viewing. You need to know what you are doing in that area. So an open cut down is performed, or either an optical trocar is performed. With that, you have an idea of where you are actually going. Now the secondary trocars in this case should be inserted under direct vision, and two-handed technique is used. So the insertion of the secondary trocar should always be under direct vision with the two-handed technique in cases where there's already scarring in the abdominal cavity. Now trocar should be at 90 degree to the abdominal wall and obliquely inserted. So with oblique insertion and at 90 degree, there's more torque, and with that you can easily insert the trocar in the body. So moving on, the rectus sheath, avoid the rectus sheath and avoid the epigastric vessels by placing non-midline trocars which are lateral to the rectus sheath. So if you palpate the rectus sheath, you can easily palpate the rectus sheath in thin, lean individuals. And if you place your trocar slightly lateral to it, you can prevent damage to the rectus sheath and the epigastric vessels. Now, smaller diameter trocars, they have better cosmesis. Smaller diameter include those with 5 millimeter less diameter. Now, the removal of secondary trocars is very important. The removal should be done safely so that no injury to any other organ might occur. Now, to avoid scars, the primary trocar should be away from the midline. In the midline, the scar is usually heapful. However, away from the midline, the scar is not that heapful. Now, avoid bladder trocars in all cases because they usually damage the bladder itself. Now, what is the technique? So what do? You grasp the umbilical cicatrix. Cicatrix is the site of your previous scar, and counter traction is maintained. After grasping that scar, you countertract it. Now, after counter-tracking, you track the umbilical stalk. Now, umbilical stalk, it usually lies inferior to the cicatrix. Now, curved 10 to 12 millimeter transverse incision is given inferior to the cicatrix. So, a curved incision is given just inferior to your scar. After that, the umbilical stalk is exposed. This is being done in the direct vision. The umbilical stalk is being exposed, and blunt dissection is done to reveal the decussation of fibers just above its junction with linea alba. So you perform blunt dissection either with a blunt instrument or in the finger, and with that you follow it till the point it merges with the linea alba. Now, a 5 millimeter vertical incision through the decussation is given to incise the fascia. Now, after incision of the fascia, you push a blunt hemostat through the peritoneal fat and to the preperitoneal fat and into the peritoneum. Once you pass this, the peritoneal cavity opens itself. Now, after that, the blunt-tipped 10 or 12 millimeter trocar is pushed through the same point insertion as the hemostat. So, this is the entirety of the procedure of what you do if there's a cicatrix or a scar that is present in the body. So again, recapping it, you hold the scar, you maintain counter traction. After that, you follow the umbilical stalk under the everted cicatrix. Now a transverse incision is given. The transverse incision, with the transverse incision, you go in, you perform blunt dissection to follow it to the decussation of fibers till it reaches the linea alba. At that point, you give a small incision. Through that small incision, you insert a homeostat and push it through the preperitoneal fat and the peritoneum into the peritoneal cavity, and through that you enter your blunt tipped trocar into the peritoneal cavity to perform your surgical procedure. So moving on, now what do? Now the laparoscopic camera is used. This laparoscopic camera, it confirms successful placement of this trocar into the cavity before insufflation. So this camera will let you know that your trocar is in the right place before you insert carbon dioxide into the abdominal cavity. Now carbon dioxide gas insufflation at low flow is done initially, and then it is increased to high flow. Why is that important? Because it fills up the abdomen and the organs are pushed down, the space is increased, the walls are pushed up, so there's a lot of room in the abdomen. And there's decreased effect of gravity as well, and with a lot of room you can easily maneuver your way through the abdominal cavity. Now there's a full open approach in patient with scars at palmar point, and in obese patient with scars the procedure to do is a blunt optical trocar. So you always go with the view, you always follow your vision in obese patients. So this was all about this section. We learned a lot. We saw various methods of abdominal incision, the purposes, and how to maintain it, how to do it, what lines, what principles to follow while giving the abdominal incisions, and finally we talked about the laparoscopic incisions, and we saw how the trocar is inserted, an average trocar is inserted in the human body. I hope you liked and understood it. For further sections, keep watching sqadia.com.